Hello, are you someone who's suffering from gynecomastia or man boobs, but you're not entirely certain if you have it? And even if you do have it, you don't know what grade it is, how severe it is, how bad it is, and hence you don't know whether it requires treatment or not. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT, and Plastic Surgery, Bangalore. And today we are going to talk about gynecomastia or man boobs and their grades or severity and how you can treat them. Now, firstly, let us start with what exactly are man boobs? What exactly is gynecomastia? Well, the thing to understand is that both men and women have breast glands. This might be surprising. Men also have breast glands. But these breast glands in men are dormant. They do not grow, they do not develop. That is the normal situation. In some cases, they can be stimulated to grow and develop, and that's when they become man boobs or gynecomastia. These situations are usually imbalances in hormones. Simply put, if there's an imbalance between male and female sex hormones in your body, if your female sex hormones increases or your male sex hormones decreases, or a combination of the two, this imbalance can stimulate the glands to grow. Now, the most common example of this is during puberty. When a young boy is undergoing puberty, there can be all kinds of hormonal fluctuations, and this can be stimulated. Other examples include over intake of steroids. Steroids can get converted into hormone like products which can stimulate this. This is particularly seen in people who gym a lot and who take a lot of steroids. Other examples are hormonal imbalances, medical conditions, diseases where there's excess of hormones being produced. And other final example is old age. In old age, again, there can be hormonal problems. Now, the problem is that even though these hormones can be stabilized, they can be controlled, particularly in puberty, they get normalized by themselves. Even once that happens, the gynecomastia does not go away. Unfortunate, I know, but that's how it is. Now, that is why they have to be treated. They cannot be burnt away with diet and exercise because it's not fat like fat in other parts of your body. It's also glandular tissue. And that is what makes this so difficult. And that is why it requires treatment. So now that we know what gynecomastia is, let us look at the grades or severity of gynecomastia. Simply put, there are four grades. Grade 1, as you can see here, is very mild gynecomastia. It's a mild increase in swelling. It can be just a generalized swelling all over the chest, which can actually look like a muscular pectoral muscle, or it can be just a little bit of gland under the nipple. Grade 2 is moderate gynecomastia, but without much skin excess. Here, the chest is a little bit bigger, it's a little bit more prominent. There isn't too much extra skin though. Grade 3 is moderate gynecomastia with skin excess. So here, gynecomastia is also more prominent, but there is also extra skin compared to a normal male chest. Grade 4 is severe gynecomastia, where there is a large enlargement of the chest, there's a lot of extra skin, and it almost starts looking like a feminine breast, like a female breast. So these are the four grades of gynecomastia. Now, what is the treatment for each of these grades? Let us look here at grade 1. In grade 1, where it is mild gynecomastia, the treatment is just liposuction. In liposuction, we make a couple of small holes, one in the nipple, one inside your armpit. So both these holes are not noticeable. Through these holes, we suck out the fat, and through the nipple hole, we also pull out the glands. Grade 1 is a very minor surgery, and in some cases, grade 1 gynecomastia patients also even don't feel like getting the procedure done. They say it just looks like a masculine chest and they're fine with it, and that's perfectly fine. But in other cases, it can be just a localized swelling around the nipple, what is known as puffy nipple. So in that case, that gland extraction is a good idea. In grade 2, wherein you have a more severe gynecomastia, it's moderate in nature, but without too much skin excess, treatment is again liposuction with gland extraction. But here the liposuction needs to be a little bit more aggressive. We need to do more of it, as you can see in this photo. Grade 3 is where things start getting a little bit more tricky, because along with the fat and glands, you also have extra skin that you need to deal with. Now, in earlier times, they would do something called a mastectomy, wherein they remove extra skin, they remove all the gland in one lump, and then they close it. The problem with this is that it often led to a deformity wherein it almost is concave, it's going inside, what is known as a saucer deformity. And there will be a noticeable mark on the front of the chest. This is not a good idea. The whole idea of doing the surgery is that men can feel confident about themselves, they can be bare chested without any inhibitions. But if you have a large scar on your chest, that's obviously a problem. So in grade 3 gynecomastia, along with the liposuction to remove the fat and glands, there's something that we need to do for the extra skin. What we do for the extra skin is we use a non-surgical skin tightening device known as Body Tight. You can see our other videos on Body Tight. This is a radio frequency machine wherein we use a radio frequency probe at the same time as liposuction. This radio frequency energy stimulates the skin to shrink and to contract. In grade 4 gynecomastia, wherein you have severe extra skin, it's almost a female breast. This is again the most tricky one. So here again, many surgeons, what they do is they remove the skin in the first surgery, as I mentioned, and that leads to a large scar. We do things a little bit differently. With this revolutionary Body Tight skin tightening device, even a lot of extra skin can be treated with the Body Tight. So in the first session, we do the liposuction, we do the Body Tight skin tightening, and then we give a good amount of compression. With this, you'll be amazed as to the level of severe gynecomastias that can be treated without removing any skin. You can see it in the photos here. So these are all patients without any skin removal, without any scars. Having said that, in those with very severe gynecomastia, there is a 5% chance that after 2-3 months, when the full result is seen, they feel like there is still a little bit of extra skin, and at that time they get that skin removed in the second stage. The advantage of this is that one, there is a very good chance that you do not need to remove that extra skin. As I said, 95% of patients don't need it. And two, even if you do remove some skin, it will be lesser than what you would have removed if you had removed it in the first surgery itself. So that is why we do it in this staged manner. So these are about the stages of gynecomastia. I hope this was informative. Now, one thing I would like to point out is that at the Venkat Center, we do things a little bit differently. In most places, this surgery is done under general anesthesia. Our specialty is that we do this under local anesthesia, wherein we only give anesthesia to the chest. You are awake during the surgery. We do it this way because it makes the surgery very, very safe. Your recovery is very quick. You can be back to work within 3 days. And during the surgery, because you're awake, we can make you stand up, see how it is looking, make you lie down, do some more. So the result is better because things look one way when you're lying down, another way when you're standing up. The other important thing that we have is the in-mode Body Tight device, which enables us to non-surgically shrink the skin and contract the skin and avoid removing any skin and giving scars in a wide majority of cases. So this is how we do things a little bit differently. I hope you found this video useful. We get a lot of patients with gynecomastia who come to us, and they're oftentimes confused as to what grade they're in. So this will hopefully, if you're suffering from this will give you a better idea of what position you are in. If you have any doubts, do feel free to get in touch with us. You'll feel more information about this, specifically about the grades of gynecomastia on our website. Our contact information is in the description and will be coming on screen shortly. If you have requests for any other videos that you would like to see, do let us know in the comments. Do like, share, and subscribe. Thank you. Have a great day.